Assalamu alaikum. Myself Rohab Fatima, registration number 2021 dvme 014 from dvme group A2. The title of my case study is Use of a new artificial vagina without a liner reduce sperm motility in a stallion. I have collected data from the journal published by the American Veterinary Medical Association. This case study focuses on the effect of using a new artificial vagina without a liner on sperm motility in a stallion, highlighting the importance of proper EV preparation and maintenance in equine reproduction. Now I discuss the abstract of the case. A 24-year-old tennis walking horse stallion was presented at the beginning of breeding season for a sudden decrease in sperm motility noticed after 1 hour semen collection. Stallion reproductive physiology and breeding soundness was normal. Collection procedure, processing temperature, semen extender addition, and seminal plasma exclusion were examined as the possible causes, then identified the reason for reduced motility. When the same artificial vagina with or without a liner was used to collect the semen from this stallion, sperm motility increased when a liner was used. Therefore, the new artificial vagina was regarded as the cause of decreased sperm motility. Now discuss the possible causes of decreased sperm motility. Decreased sperm motility in stallion has been attributed to diseases, maybe due to the age of animal, season just like the hot weather, stress induced by the physical activity, freezing and cooling procedure for preservation purpose. But here we investigate the reason for an abrupt decrease in sperm motility in a healthy stallion that had sperm motility in the previous season quite normal. Move towards the case presentation. A 24-year-old tennis walking horse stallion with no sign of disease and with normal fertility parameters in a previous breeding season has a sudden decrease in sperm motility. Semen was collected in an artificial vagina using an established protocol. Sperm concentration, motility, and morphology was assessed immediately after the collection, and all the parameters were within the normal values. But however, 1 hour after the sperm collection, sperm were immotile. This table indicates the normal parameters in a stallion during 2021 and 2013 breeding season. Concentration, total sperm, morphology percentage, and motility percentage, that were all parameters were in the normal value. Looking forward for differential diagnosis. Chronic motility reduction has been reported in both young and old stallions. Motility reduced may be due to the warmer seasons, due to the stress caused by the physical activity, infectious diseases just like equine arthritis virus disease, testicular trauma, and iatrogenic spermicidal toxin and various handling method may be the cause of reduced motility. Moving towards a confirmatory diagnosis, just for the confirmation purpose, temperature was measured with an infrared thermometer. Various semen extenders were used, just written below. Semen was extended with 1:1 with the extender EZ. Seminal plasma was removed by the centrifugation. This procedure did not improve sperm motility. Based on the differences in semen motility when collecting with and without a plastic EV liner, we inferred that the EV had component that adversely affects sperm motility. Moving towards the treatment. For treatment purposes, experiments were performed. Samples were collected from 3 stallions using the same EV previously described, both with and without a liner. The same extender was added to each sample. To verify if these results were specific to this stallion and were repeatable in other stallion, the same EV was tested with or without a liner in 2 other stallions, which were a 4-year-old Appaloosa and 11-year-old American Paint Horse. These graphs also show the result of the experiments. Sperm from the stallion 2 were immotile at 0 hours, and sperm from the stallion 3 were immotile at 1 hour. Presence of a spermicidal component in a newly purchased AV was suspected. On evaluation, after 1 hour, motility of each sample collected using a liner was not affected. In sample collected without a liner, motility decreased to 0% within 1 hour. When collected with a liner, semen motility was unaffected. Therefore, we inferred that the newly purchased AV caused decreased sperm motility. Then the results of the experiment was, when a liner was used in AV, collected semen had expected sperm motility in all the 3 stages. The crux of the case study is, sperm motility can be affected by a season, cleaning protocol of AV and penis, poor managemented semen handling practices, infectious and non-infectious diseases, and chemical residue that remain on the equipment. Reproductive pathology was not noted in these three stallions. Sperm motility was similar when tested without a seminal plasma in these three stallions. In the present case, the AV was suspected to be the reason for the sudden change in the sperm motility. At the end, concluded the case study with some important points. Artificial vaginal surface can be toxic to sperm. Surface of a newly AV may contain toxic material that can render sperm immotile. Verify safety of a newly purchased AV by testing semen quality immediately and one